If you wake up in the mornings with numb hands and notice that you're dropping things from your hands more often, you might have carpal tunnel syndrome. Basically, it's a problem where the median nerve, which runs from the cervical area to the hand, gets compressed. Most of the time this happens right here in the carpal tunnel, which is why it's called carpal tunnel syndrome. And it happens in the median nerve, which is a nerve that runs right under that tunnel and goes toward the thumb, index, and middle fingers. It provides most of the grip strength and sensation in the entire palm of the hand, especially on the right half. Today I'm going to show you a couple of exercises that will work very well to release that nerve, to relax the muscles, and ultimately to improve the symptoms. Let's start by stretching all the flexor muscles, which have a very important relationship with the carpal tunnel that's located right in this region. To do this, it's very simple. We start sitting down and we place one arm straight out in front of us. The important thing is that the elbow is fully extended and that the arm is parallel to the floor. From here, with the opposite hand, watch what I do. I want to grasp the pinky side of the H and then pull the palm of the hand toward me. This will create a tightness in all the muscles located on the inside of the arm and even here in the carpal tunnel. I'm going to hold this position for 30 seconds, and with each exhale, I'm going to pull the palm a little more toward me. Common mistakes: bending the elbow too much, letting that arm drop down. Ideally, we should keep it horizontal. We're just going to do 3 or 4 breaths so you can see it properly. I inhale, fully extend my elbow. Exhale, notice I'm pulling on my fingers and hold the position. Breathing will always help us set the rhythm for the exercise. I inhale, relax, and exhale. Goodbye. 2, we inhale and exhale. 3, make sure that this area here, which is the crease of my elbow, is also facing upwards, because we could also do it with that crease facing more towards the center. Let's do the last one. I take a breath in, exhale, and push that hand to feel a good stretch in all those flexor muscles. Next, we're going to focus on the thenar muscles. These are muscles that are related to the thumb, and they're located exactly right below it. These are very strong muscles, and once again, they can be involved in that carpal tunnel we've talked about. It might seem complicated, but believe me, it's not. We're basically going to stretch the muscles found in this region. To do this, go ahead and do the same. Place your hand fully extended. But this time, instead of grabbing here at the pinky finger, we're going to grab the thumb. And look, what I want is for you to rotate that thumb as much as possible, as if you wanted to bring it down. At the same time, keep your hand fully extended and your elbow straight. This is going to create a stretch throughout the thenar muscles, not as intense as the one we just saw, but also very effective. I grab that thumb. I pull down. I hold the position throughout the entire exhalation. I take a breath. I exhale. And I rotate. An incredible stretch right here. I take a breath. And I release. 2. I recommend opening your hands so the stretch is more effective. 3. Last repetition. And 4, very, very good, very effective. With just these 2 exercises, you should already notice some relief, some improvement in the symptoms. Next, we move on to a massage of the same muscles, the hand flexors and the thenar muscles. For this, we can use a foam rubber ball, or you can also use a tennis ball, or even some cream and your own fingers or your knuckles. We'll review 3 or 4 techniques you can use to improve. First, for the symptoms, we should massage the flexors that are located from the elbow to the wrist, from proximal to distal. That is, I place the little ball here and always try to make circles toward my wrist, circles toward my wrist, circles toward my wrist. Eventually, I reach my wrist. Once I'm there, I switch again and start over. Circles toward my wrist, circles toward my wrist, circles toward my wrist, and toward my wrist, and I start over. How many times? Well, you can spend a minute, 2, 3 minutes on it. It's quite pleasant, so you can do it throughout the day without any problem. It's normal for the fingers to move or flex when we do the exercise because we're massaging the muscles that create that movement, and we work all those muscles. Very, very pleasant. Circles from the elbow to the wrist. If you don't have a little ball like I do, it's not the end of the world. We can use our knuckles. We put on some cream, some oil. We place our knuckles right here where the muscles on the inside of the elbow begin. And from here, look, I use my knuckles on my hand, sliding, sliding, sliding very firmly as well all the way to the base of the wrist. I apply that pressure again. I press hard, and thanks to the oil my knuckles can slide, and it produces a very, very, very pleasant relaxation. In fact, these inner muscles are always very tense, always very contracted because they have exceptional strength compared to the muscles on the opposite side, the extensors. Let's do one more. Here's one last great technique I'll show you using the thumb. If you have good strength in your hands, you can press your thumb right there at the base of the muscles using a little bit of cream. And again, go all the way down to the base of the wrist. We use a little cream, press that finger in, and slide down to the base of the wrist, and so on. Very, very pleasant. Very, very effective. Great job. We can use either one or all three. I like them all. I really like the ball one. I really like the knuckle one, the thumb one a little less because it needs a certain intensity. Secondly, we're going to have to massage all of this Thenar muscle group. For that, I recommend using your fingers again. We can use all four fingers or the thumb. What we want is to separate that Thenar eminence from the center. The carpal tunnel is located here. The transverse adenine nerve runs right underneath. So we're going to take our fingers and place them right here where you see this line, which many people call the lifeline, and push that muscle toward the base of the thumb. You can use a little bit of cream again, a little bit of oil is welcome. Work your fingers in and move all that muscle toward the base of the thumb. Work your fingers in toward the base of the thumb. Work your fingers in toward the base of the thumb. We can do it with the long fingers. As I said, or with the opposite thumb, applying muscular pressure from the middle area to the base of the thumb. Very pleasant as well. I recommend using some oil because it can have very good results. Then we can also massage the adductor muscle of the thumb, which is located right here. It's one of the strongest muscles in the hand, and its function is to bring the thumb toward the index finger or the palm. And to massage it, we are going to take your index finger and thumb from the opposite hand and position them like a pincer. Look closely. I'm placing my index finger and thumb so that the palm of my hand is held like a clamp with my fingers. From here, the movement we need to make is as if we were crumpling a small ball of paper with our fingers. It's not complicated at all to massage that deep muscle. So take your hand, place your index finger and thumb properly, and make a circular movement with both your thumb and index finger. Look, I'm not doing anything strange, just simple circular movements. You can work on it for 30 seconds to a minute with a bit of cream, and I assure you it will have a very, very good impact on the pain in your hands and also on carpal tunnel symptoms. Once we've finished this part focused more on massage, we're going to move on to neural mobilization, which is also extremely important. And how are we going to do it? Through mobilization. Neural, as you know, the nerves that reach the hand, which are these yellow fibers you see here, that run all the way to the wrist. They carry electricity to our muscles and allow us on one hand to contract, but on the other hand, they also let us send all sensations to the brain so it can make decisions. They're like a two-way street. Alright, well, sometimes that median nerve isn't compressed inside the carpal tunnel, but there are other structures that could be causing its compression. Mobilizing that nerve will help release it wherever that compression is and reduce the symptoms. Don't worry, because at the end I'll tell you how much of each exercise you need to do. What I want is for you to stand very close to the wall, with your arm fully extended and your fingers pointing backward. Look at this camera angle here so you can see how I'm positioning it. That arm is placed parallel to my body and with the fingers completely facing backward. It doesn't have to be too low or too high, it has to be in line with your shoulder. It should feel like a pillar supporting your body against the wall. And from here, it's very simple. Once you're in this position, you'll start to notice neurological sensations, maybe a slight loss of sensation, maybe more of an electric shock pain. Maybe it feels like you have pins and needles in your hand and arm. That's completely normal. From here, what we're going to do once that arm is locked against the wall is move the head and stretch the nerve from this side. Basically, we have to bring the right ear toward the right shoulder, and when we do that, those neurological symptoms increase a lot, exponentially. The important thing is that you notice it, not that it causes you pain, so look for an intensity level that isn't too painful. We achieve this by bending the elbow a little or by relieving tension by moving the palm slightly away from the wall. If too intense, move your palm away or slightly bend your elbow. Standing up straight here, we just need to turn your head to the right. I add tension, hold it for a few seconds, relax, turn my head to the right, add tension, relax, and I notice how with each movement of my head, that tension increases exponentially. Very good, but be careful, always finding the level of intensity that works best for you. Let's do a couple more. Down, relax. And back. You're really going to feel it in your hand, your forearm, and even in your shoulder. Ideally, keep that arm extended across the body like a column with the fingers fully pulled back, as you can see here. And to reduce tension, either move the palm slightly away or lift the fingers a little, which also works, or we bend the elbow a little. It's important that you try it yourself at home and choose the level of difficulty that best suits your needs. Secondly, I also want to work on a very important area, which is right below the collarbone, with a stretch for the muscles at the front of the neck. It's also very simple, even if it seems complicated. For this, I recommend you undo that button on your polo shirt. Locate the collarbone, which is that bone found right between the neck and the chest. And with your fingers, reach it, grab it, hold it, and keep it there. You can use one hand or use both hands. We just want to hold it in place. We want to put our fingers on top and keep it there. And from here, we're going to do an extension and lateral flexion. First, the chin goes up and you'll start to feel some tightness in your skin. And secondly, your gaze shifts to the right, as if you want to bring your right ear closer to your right shoulder. And there, wow, hold the position. A lot of tightness in all the muscles at the front of the neck, very pleasant. Again, it might cause some discomfort, but it shouldn't cause pain. We hold this position for how long? Well, 3 or 4 breaths, a total of 30 seconds for the exercise to be effective. I'm just going to take a couple of breaths because it's very pleasant. It gives a really good feeling, and we take advantage of the exhale to pull that clavicle down to add more intensity. I inhale, then exhale. And I lower it. Very, very good. I slowly return my head to its initial position. And after working on stretching, after working on massage, after working on neural mobility, we have one last thing left, and that's strengthening. As I mentioned before, in the forearm and hand, everything tends to close up. A lot of flexion strength, a lot of muscle here, and little muscle here. Therefore, we're going to have to work on it. That opening is to balance those muscular forces. By the way, before we continue, I hadn't told you this. If you want, you can subscribe to my newsletter, a newsletter where I send out all the videos I've published during the week every week. In addition to those videos, you'll also have access to my library of over 1,000 videos organized by body area, and you'll also get early access to the programs I launched throughout the year. Last year, there were more than 4,000 people. It's a completely free newsletter, and you receive the course on Sundays. To do this, simply sign up using that card up above, leave your email, and you'll be in. For strengthening, we're going to need a band like this. Take a good look and a hand that closes as if you wanted to say, I have a lot. I rest that hand at the level of my leg and place the band just above it. The harder the band, the more difficult the exercise will be. Once I have it here, what I'm going to do is grab that band with my opposite hand and pull down. This allows me to add resistance to the exercise. The goal is for the fingertips to open up. Look, here I'm opening them. 1, 2, 3, relax, and they close. The movement is small, minimal. However, the strengthening you'll feel in all the extensor muscles, both in your fingers and forearms, is quite powerful. I'll show you again, okay? I place the tips of my fingers upward. wrist in front of the knee, which I hadn't mentioned. I let the band hang down and grab it from underneath with the opposite hand. I pull to add resistance, and from here, look, I try to open 1, 2, 3, 4, and 5. Relax, very, very good. I try to open 2, 3, 4, 5. Relax, very good. One more. 2, 3, 4, and 5. And this way we're strengthening the whole back of the hand. Very good. Now comes the important part. How do we organize this during the day? I've given you a lot of things to do, but it's hard to know when to do them. I generally like to do neural mobilization. I do this before going to bed and in the morning. Es lo que más efecto te va a dar, like the one where you were leaning against the wall with your hand, or the one for the clavicle. The rest of the exercises you can really do whenever you want. They are designed to relieve pain, to relieve tension, and they will help improve your symptoms. The best time to do them is usually before going to bed and in the morning, to avoid any compression the nerve may have suffered during the night. Apart from that, you can do as many sets and as many times as you want of the neural gliding exercises. I recommend doing 1 or 2 sets of 10 repetitions, and it's the same for the rest. You can do 1 or 2 sets of 10 breaths. As we've seen throughout the video, there's no fixed dosage. Just use your judgment and do at least what I just recommended. Nothing more. I'm sure these exercises will be helpful and will help you relieve your symptoms. I hope now you can help me by spreading the word, sharing my content with all those who need it. Just share it and you'll be making physical therapy accessible to everyone. I hope you enjoyed the video, and I truly hope to see you again in one of my other videos. Goodbye, friends.